Professional medical monologue, understanding and managing nighttime urination in later life. Good morning, everyone. I'm Dr. Williams, and I want to talk with you today about something that affects many of us as we get older, waking up at night to use the bathroom. In medical terms, we call this nocturia, which simply means nighttime urination. If you're waking up 2 or more times each night to urinate, you're certainly not alone. Studies show that this affects anywhere from 28 to 62% of people between the ages of 70 and 80. That's more than half of us in this room. So please know that what you're experiencing is both common and something we can work together to improve. Let me start by explaining what's happening in your body as you age, because understanding this process is the first step toward feeling better. When we're younger, our bodies have a natural rhythm that helps us sleep through the night without needing to urinate. This rhythm is controlled by a hormone called vasopressin, also known as antidiuretic hormone, or ADH. Think of this hormone as your body's nighttime supervisor. It tells your kidneys to slow down urine production while you sleep, concentrating your urine so you make less of it during those precious nighttime hours. However, as we age, this system doesn't work as efficiently as it once did. The natural rhythm of this hormone becomes disrupted, and in many older adults, we see very low or sometimes undetectable levels of this hormone at night, when it should be at its highest. This means your kidneys keep producing urine at the same rate they do during the day, instead of slowing down for sleep. In some cases, up to 85% of your total daily urine production can happen at night, which explains why you might feel like you're spending more time in the bathroom than in bed. Your bladder also changes as you age. The muscle walls of your bladder become less flexible, and your bladder's capacity to hold urine comfortably decreases. Additionally, the bladder muscle itself may become overactive, sending signals that you need to urinate even when your bladder isn't completely full. Think of it like a smoke detector that becomes overly sensitive. It goes off even when there's just a little cooking smoke in the kitchen, not necessarily a real fire. Your kidneys too undergo age-related changes. They become less efficient at concentrating urine, which means they produce more dilute urine throughout the day and night. The kidney's ability to respond to that important hormone I mentioned earlier also decreases, so even if your body is producing the hormone, your kidneys may not respond to it as well as they used to. There's also the matter of how aging affects your sleep patterns. As we get older, we spend less time in deep sleep, the most restorative stage of sleep, and more time in lighter sleep stages. This means you're more likely to wake up when your bladder sends even mild signals that it's filling up, whereas when you were younger, you might have slept right through those same signals. Now, let's talk about the specific things that can make nighttime urination worse. One of the most common culprits is the timing of when you drink fluids, especially in the evening hours. I often tell my patients to think of their body like a sponge that has been squeezed out during the day from walking around and being active. When you lie down at night, gravity helps that fluid move from your tissues back into your bloodstream, and your kidneys process this extra fluid, creating more urine. If you've been drinking fluids in the evening, water, tea, or any other beverages, you're adding even more liquid for your body to process overnight. Medications play a significant role as well, particularly diuretic medications, which many of you may be taking for high blood pressure or heart conditions. These medications are designed to help your body get rid of excess fluid, which is beneficial for your heart and blood pressure, but they can certainly contribute to nighttime urination. The timing of when you take these medications can make a substantial difference. If you're taking them in the evening, you're essentially asking your body to get rid of extra fluid, right when you want to be sleeping peacefully. For the gentlemen in the audience, prostate problems become increasingly common with age and can significantly contribute to nighttime urination. As the prostate gland enlarges, a condition called benign prostatic hyperplasia, it can obstruct the flow of urine, making it difficult to empty your bladder completely. This means you may need to urinate more frequently, including during the night, because your bladder never feels truly empty. What's interesting, though, is that research shows that even when we surgically treat prostate problems, the nighttime urination doesn't always improve completely, suggesting that there are often multiple factors at play. Uncontrolled diabetes is another important factor to consider. When your blood sugar levels are consistently high, your body tries to get rid of that excess sugar through your urine, which causes you to produce much more urine than normal. This is called osmotic diuresis. Essentially, your body is trying to flush out the excess sugar, taking a lot of water with it in the process. Heart conditions, particularly congestive heart failure, can also contribute significantly to nighttime urination. During the day, when you're upright and active, fluid can accumulate in your legs and feet due to gravity and poor circulation. However, when you lie down at night, this fluid redistributes throughout your body, increasing the amount of fluid your kidneys need to process. Your heart, if it's not working efficiently, struggles with this sudden increase in fluid volume, and your body responds by trying to eliminate the excess fluid through urination. Sleep apnea is another condition that many people don't realize can cause nighttime urination. When you have sleep apnea, your breathing repeatedly stops and starts during sleep, causing changes in the pressure within your chest cavity. These pressure changes trigger the release of certain hormones that tell your kidneys to produce more urine and eliminate sodium. Additionally, people with sleep apnea often wake up frequently during the night, and many times they'll use the bathroom simply because they're awake, even if their bladder isn't particularly full. Now, let me share with you some practical recommendations that can significantly improve your situation. The good news is that many of these strategies are things you can implement starting today, without any medications or complex treatments. First and most importantly, let's talk about managing your fluid intake. I recommend that you avoid drinking fluids for at least 2 to 3 hours before bedtime. This doesn't mean you should become dehydrated. It's crucial that you drink plenty of fluids during the day to stay healthy. Aim for about 2 to 2.5 liters of fluid daily, but front-load your fluid intake to the earlier parts of the day. Think of it like filling up your car's gas tank. You want to do most of your filling up when you have plenty of time to process those fluids before bedtime. Pay particular attention to caffeine and alcohol consumption in the evening hours. Caffeine, found in coffee, tea, some sodas, and even chocolate, is a natural diuretic, meaning it increases urine production. I recommend avoiding caffeine after lunch, as it can stay in your system for 6 to 8 hours. Alcohol also increases urine production and can disrupt your sleep patterns, making you more likely to wake up during the night. Additionally, avoid carbonated beverages in the evening, as the bubbles can irritate your bladder and make you feel like you need to urinate more frequently. One of the most effective strategies I recommend is elevating your legs for 2 to 3 hours in the afternoon or evening, well before bedtime. You can do this by lying down on your bed or couch and propping your legs up on pillows, or by sitting in a recliner with your legs elevated. This position helps gravity move the fluid that has accumulated in your lower extremities back into your circulation, where your kidneys can process it while you're still awake and active. Think of it as giving your body a head start on processing that fluid before you lie down for the night. Compression stockings worn during the day can also be helpful for the same reason. They prevent fluid from accumulating in your lower legs and feet, reducing the amount of fluid that gets redistributed when you lie down at night. If you're considering compression stockings, talk with your doctor about the right level of compression for you. Make it a habit to use the bathroom right before getting into bed, even if you don't feel a strong urge to urinate. Empty your bladder as completely as possible by taking your time, relaxing, and perhaps even leaning forward slightly to help ensure complete emptying. For gentlemen, this might mean sitting down rather than standing, which can help ensure more complete bladder emptying. The timing of your medications, particularly diuretics, can make a tremendous difference in your nighttime symptoms. If you're taking water pills or diuretics, talk with your doctor about taking them earlier in the day, ideally 6 to 8 hours before bedtime. For many people, taking these medications in the mid-afternoon allows the diuretic effect to wear off by bedtime. However, never adjust your medication timing without discussing it with your healthcare provider first, as the timing may be important for managing your blood pressure or heart condition. If you have heart failure or problems with fluid retention, work closely with your doctor to ensure your condition is optimally managed. Sometimes, adjusting heart medications or diuretic dosing can significantly improve nighttime urination. If you notice that your nighttime urination has suddenly worsened, especially if it's accompanied by swelling in your legs, shortness of breath, or increased fatigue, contact your doctor promptly, as this could indicate that your heart condition needs attention. For those of you with diabetes, maintaining good blood sugar control is crucial. Work with your healthcare team to keep your blood sugar levels within target ranges, as this will reduce the osmotic diuresis I mentioned earlier. If you're waking up frequently to urinate and you have diabetes, check your blood sugar levels. High overnight blood sugars could be contributing to your symptoms. If you suspect you might have sleep apnea, particularly if you snore loudly, wake up gasping for air, or feel tired despite spending adequate time in bed, discuss this with your doctor. Sleep apnea is very treatable, and addressing it can sometimes dramatically improve nighttime urination. Create a safe pathway to your bathroom for nighttime trips. Use nightlights to illuminate the route, remove any obstacles or loose rugs that could cause falls, and consider keeping a portable urinal or bedside commode nearby if mobility is an issue. The goal is to make nighttime bathroom trips as safe and easy as possible. Maintain a regular exercise routine, as physical activity can help with overall circulation and fluid balance. Even a daily walk of 20 to 30 minutes can be beneficial. Some research suggests that evening exercise might be particularly helpful for reducing nighttime urination, possibly because it helps process fluid from your tissues. Consider keeping a simple diary for a few days, noting what time you go to bed, how many times you wake up to urinate, approximately how much you urinate each time, what you drank in the evening, and when you took your medications. This information can be incredibly valuable for you and your healthcare provider in identifying patterns and potential solutions. It's important to know when to seek additional medical help. If you're following these recommendations and still waking up multiple times per night, if your nighttime urination has suddenly become much worse, or if you're experiencing other symptoms like burning during urination, blood in your urine, or significant daytime fatigue, it's time to have a more detailed conversation with your healthcare provider. Your doctor might recommend additional treatments, such as prescription medications that can help reduce nighttime urine production or treat underlying bladder problems. There are safe and effective options available, but they require careful monitoring, especially in older adults, to ensure they don't cause other problems like low sodium levels. Remember, nighttime urination is not something you simply have to accept as an inevitable part of aging. While it's common, it's also treatable, and improving it can significantly enhance your quality of life and sleep. The strategies I've outlined today are evidence-based approaches that have helped many of my patients sleep better and feel more rested during the day. I want to emphasize that every person's situation is unique, and what works best for you might be a combination of several of these approaches. Be patient with yourself as you try different strategies, and don't hesitate to work closely with your healthcare team to find the best solution for your individual circumstances. Good sleep is crucial for your overall health and well-being, and you deserve to wake up feeling rested and refreshed. Thank you for your attention today, and I hope this information helps you on your journey toward better sleep and better health.